Very good afternoon to one and all. So it feels great to have fair amount of audience in spite of being the fag end of the day after being a busy day for everybody, and welcome you all to this very unique IC again on sterilization processes. So my role here today is going to be more of a summarization of what we've heard from the two stalwarts in the field of quality and sterilization. So at the outset, I would like to thank Kumran sir for having me here, and Nirmal sir for giving me this opportunity to be a part of this. So before we jump to the proper troubleshooting part, some basic principles that I would like to reiterate upon, basically summing up today's session, is the three main indicators that we are going to be worried about. What are they? Time, temperature, and pressure. So I hope if there is one message that should be driven home from today's IC, that should be the case, right? That should be the info. So what I'm going to try to tell you is to see that they are working properly is what we use these indicators and all the processes in place. So I'm not going to delve into the details of each of the classes because that has been dealt with exhaustively. So some pictures to show as to what is expected of each class. As you can see here for class 1, it is just going to let us know whether these packages have been exposed to physical conditions of the sterilizer or not, right? So they are not going to give us an idea about whether what is enclosed within that package has been made sterile, right? So that's pretty much what class 1 does. In case the very class 1 is going to show us some signs of failure, then that basically means that the sterilizer hasn't reached the temperature set point, right? So that is a flaw right at the basic level. So what do you need to do? You need to check the power source, you check for leak from the steam generator, and one important point is we saw in Sir's talk, the ability of an autoclave is nothing but to get rid of the air and to get steam in, maintain it at the right temperature and pressure for the given period, right? So getting air out is also a very crucial part of the whole process. And remember that the chamber drain block, which is preventing this air from escaping, right, that is again going to completely disturb the process of sterilization, and the steam also is hindered from reaching the right temperature and pressure. So this is again shaking the very basics of the process of an autoclave. And wrong temperature being entered, not adhering to 121 degrees for 5 minutes, all of that again means that class 1 itself can show us signs of not functioning properly as an autoclave should. Now moving on to class 2, like we've dealt with exhaustively with Bowie-Dix test, available in two forms, different shapes. We can use it as strips, we can use it as a whole paper, and it is also available in this square shaped shape and size. So like Sir was mentioning, the first step of the day, it is to be done with each day within a dynamic air removal sterilizer. And what does that check for? So my role here is to let you know what does each class look for. So air leaks, inadequate air removal, and inadequate penetration of the steam, and last but not the least, presence of non-condensable gases, right? So this is a picturesque demonstration of what an unused test looks like, and the test not having been passed, and lastly the test being passed. So remember, if there is an air leak, it's as simple as that the air is not going to steam is not going to be able to penetrate the load properly because air is going to hinder the penetration. So we need to run the vacuum leak test. Secondly, like I mentioned, if there is a condensation in the steam jacket, that can lead to certain cold spots. And these cold spots, what do we mean by this cold spot, is the temperature is best only if the steam is in the form of steam rather than the liquid form. We all know that the boiling point is a concept where the steam is at a much higher energy, like Sir mentioned, 7 times the energy as that of water in its liquid form in the same temperature, of 100 degrees. So we need to check the steam valves to ensure that this mistake doesn't happen. And this is a very underestimated point in our routine practice. Sometimes we buy Bowie-Dix strips in bulk, and what we fail to do is check its expiry date and the storage conditions in which they are placed. So this is often missed out on even by our OT personnel. So that is one area that we must be aware of, and let the OT personnel know that this is important to not store them for long and ensure that they are well within their expiry dates. And we just saw that if there is no warm-up cycle, we need to run a 5-minute cycle prior to doing the Bowie-Dex test. And some part which is again often neglected is the incorrect procedure. It is important for us to ensure that the chamber is empty and the right temperature is set to be able to achieve a good amount of sterilization. And now moving on to class 5, so integrating indicators. What do I mean by that? See, like we discussed, there are multiple parameters of concern: time, pressure, and temperature. So class 5 helps us, address each one of them at one go. So it is designed to react to all the critical variables at play and should be used within each sterilizer container. See, that is what again I would like to emphasize, is that using it as a one for all of what we do is not the right way to do it. And even for using like what sir was saying, for flash sterilization modified into the modern technique, it is advised to use it along with that as well, right? So some of the procedural errors associated. Now placing one pouch inside another, or one container into another, all of that should be avoided, and packing it too close and in a very crowded fashion should be avoided. Last but not the least, as sir has demonstrated wonderfully in the videos, the size of the pack should match with the instrument in question. There is no point using a very big pack for a very small piece of instrument, and that is going to create a lot of discrepancy. And using artificial linen, what is the solution? Use recommended packing material. We just spoke about the two types of fabrics that are based on the weaving pattern, and also use it of the appropriate size. So second part of the procedural error is the loading part. So overstacking it one on top of the other, overloading it and packing it too close, all of these should be avoided, so that adequate space between the trays allows for better penetration of the steam. Ultimately, at the end of the day, you want the steam to penetrate the pack and sterilize the contents. If you're going to hinder it in every possible way by keeping other packs around it, it's not going to serve the purpose. And if there is signs of malfunctioning of the equipment, like incomplete air removal, inadequate steam, inadequate temperature being built, insufficient time, or the quantity of the steam being poor, run certain sterilization cycles, and also make sure to test the vacuum pumps. So vacuum pumps are often a very ignored part of the sterilization process, and their function is quite crucial. And the PCD part. So sir has wonderfully explained about the process challenging devices. The aim is to remove the air from the hollow instruments. So as depicted in the table, what to use for solid and what to use for hollow instruments are to be very clearly understood. And the ability of the autoclave to penetrate steam through the lumens of this hollow instruments is what is detected by the PCD. And the test is involving placing a chemical strip, and we saw in the video, at the end of the tubing. So the steam has to have traveled the entire distance of the tubing to be able to pass this test, right? So these are all the reasons why. And air pockets, like sir mentioned, is one crucial part inside hollow tubings that is quite unique to this type of instruments that we have, like the phaco tubings, right? So that is one important point. Lastly, the biological indicator, Geobacillus stereothermophilus. So if the spores survive, then there is a problem. If there is no spore that survives and then the test passes, that shows complete sterilization. And last topic, wet packs after sterilization, what do we do? See, a wet pack can cause contamination issues because of excessive moisture that can act as a pathway for microbes, right? So two types of moisture. One is the external moisture, which is associated with the sterilizer leak, insufficient steam removal by the vacuum pump. And second is the internal moisture, which is the classical problem of insufficient air removal, improper packing, as we just discussed. So what are the operator related errors which can result in this? Like I discussed, overloading, wrong cycles of sterilization, improper handling, and all these are to be avoided to avoid this wet pack issue. And what if there is a component failure? The way to go forward is to check all the traps of steam on the autoclave, and all the linings and the pipes are in proper condition, and also the valves are functioning properly. And lastly, the steam supply issues to be taken care of by making sure you have proper maintenance of the equipments and providing adequate pressures and all those criteria to be satisfied. So lastly, how do we troubleshoot it? Avoid improper storage. And not only that, once you take the load out of the sterilizer, what do we do after that also counts. So a load that comes straight out of the sterilization is often hot and can attract a certain amount of moisture, and stacking the load on top of another like pile of books, that is one mistake we must avoid, because it basically creates a pocket of air between and two different packs, and that can be a pretty much a good place for the buildup of moisture, and hence a wet patch in this whole process. So with that I conclude my talk. Thank you.
Thank you, Niranjan, for this wonderful talk. I think wet pack is something which is very common, and most of us could have seen a wet pack at one point of time or other in your practice. Having a little bit of moisture is all right, but having a completely wet pack is actually not acceptable, because you can't store this pack, because when the pack is wet and you put it in a CSSD area, this is obviously going to attract more moisture and bacteria into the pack. So wet pack is one of the major source of contamination and loss of sterility in a pack which is kept in the CSSD area. So if you have any questions, we'll be happy to take it. So could you please use the mic, sir, because...
How long we can keep the autoclave material once we have done one cycle of autoclaving? Then after what time we can use the material?
So as I told you, if the instrument is packed, there are actually no literature to say that it should be kept at this particular period of time.
Okay.
So as a hospital, you can maintain your own process, but as I told you in one of the slides, and I gave you an example of Newton's law, a pack which is sterile continues to be sterile unless it is disturbed by any of the other factors. For example, the package is being torn, or there is moisture on it, so all these factors. So ideally at our hospital, we keep the sterile goods for 2 to 4 days.
Okay, thank you.
So actually if it is not being disturbed and the pack is sterile and your room temperature is good, you can keep it for a longer duration also.
Disposable gowns. Can we re-sterilize it with the ETO?
Yeah, that's what see, the disposable gown is should be disposed after single use, because what happens is when they are ETO'd and they come to you and they open the first time, these pores of that gown are closed. So if you're going to autoclave this, only one side of this gown is going to be sterile, whereas the other side is going to be unsterile. Because the steam will not be able to penetrate the gown because there are no pores there.
Even ETO.
Even ETO.
And before, in the beginning, I used to use a vertical autoclave and a cloth around the instrument box. But what happens is there are a lot of fibers on the cloth, and that gets into the instruments, and that gets into the eye, and that causes the end of the root to get inside the eye. So this thing, when I stopped it and the packing the other way, the sealing and all these things, it's totally gone.
Yeah, so that is one of the basic reasons why we say we are going away from linen, because if you see the cost of handling linen, the time consumed, the amount of water you use, the washing material, it is not very economical. So that's why the disposable things have come into place. And actually, if you do a proper analysis, you will find the disposables are much economical and safe rather than the linen.
The handpiece of the FECO handpiece and the tubings, if we do ETO, I think it gives a longer lifespan for those like the handpiece and things like that, because
yeah, basically because ETO uses less heat. It's around 70 degrees Celsius, and plasma uses much lesser than that, 40. So less heat, the instrument's longevity is increased. That is the main reason why plasma is really finding its way inside.
The tubings is good. ETO is good, right? No problem with the
Yes.
tubings.
Yes, ETO can be used for the tubings. Only thing is that you should have a proper aeration time of 28 to 48 hours preferably, but you should understand that ETO gas is carcinogenic, so ensure that you have a proper protocol to safeguard your stuff.
Yeah, I mean the exhaust is there and it all gets
Yes.
out. But other than that, anything else for the ETO safety?
Nothing much, but you should also ensure that the canisters are disposed of properly, because if you find something out in your normal biomedical waste, then it's a problem. So ensure that you have a proper biomedical waste disposal of the empty canisters.
Thank
Thank you, Kumar. The only thing is, many times we are asked, what if there is no ETO facility? Or let us say if there is a failure of ETO, how do we sterilize these tubings?
So if you're talking only in particular of tubings, then you can also run the steam sterilizing cycle using the Class B autoclave for your steams, for your tubings.
Okay, but no, about the delicate instruments or tubings like vitrectomy and others, like cautery wires.
You have to find an
previously we
alternate.
use the formalin chamber, right?
The formalin
Now
chamber
it's
is out of the question.
it's
Sidex
out of
chambers are out of the question. Really, probably you have to find out what is the cause of the failure of the ETO,
Yeah.
get it ready, and
True, but
do-
then apart from that, is there any other solution?
plasma sterilizers can be used. Otherwise,
Plasma is only.
nothing else. Only ETO or plasma as for now for the other things. And formaldehyde chambers, not
out.
safe, sir.
Is out, it's
Because formaldehyde by itself is a carcinogen.
Yes.
So plasma or ETO is the only answers.
Air sterilization, we use this silver oxide, I think. It's silver, that kind of the blower on the...
For air sterilization. Okay.
And we of course use the UV light also. But, and we have a HEPA filter, just the tabletop, right? And this, how is this silver thing?
So silver oxide and all these formaldehyde for sterilizing the air is actually not good, because they are still carcinogenic, and it keeps the room sterile only till the staff enter the chamber. So once the staff enter the chamber, all the squams which fall from a body surface, the hair and the moisture when we speak, contaminate the room. So a room is sterile if no one is going to enter inside. But once all the staff enter inside, then these form of sterilizations are of no good. And the only thing which is proved is your HVAC system, which is heating air ventilation system, which would give a continuous process of clean and purified air even when the persons are present inside the theater. These small tabletop, these HEPA filters, the problem with them is that they cannot be validated. See, for example, you have an area of 400 square feet and you have a small HEPA filter which is not going to suck in all the air in a 400 square feet and give it back. Correct? So you need a HEPA filter which is able to take in the air present inside a 400 square feet room, which is 400, say 20 into 10 by 20, which is a huge volume of air. That is 3,600 cubic feet of air. How can you expect a small HEPA filter to purify it? So that is the basic concept. These tabletop HEPA filters are of no good.
What about bigger one, or
Sorry, sir.
many of those, or bigger capacity ones which can,
The problem is they cannot be validated. Very difficult to validate them. Yeah, that is the purpose of it, sir. Because sterilization is different from disinfection. We never try to sterilize a theater. I only try to disinfect it. Yes, Exactly. So there's another valid point because these HEPA filters don't bring in fresh air. So only the stale air inside is keeping on being filtered. So the HVAC system ensures that the air enters from the outside, which is also fresh. They are air circulators rather than air filters. So as I told you before, the 4 phases, see after the 121 degrees Celsius for 15 minutes is reached, okay, that is the contact time. So once this is reached, the steam inside the chamber has to be removed or else they will form droplets over the instruments which will lead to a wet pack. So once the steam has done its work, okay, we don't need the steam, you take it out immediately. So that is the phase, it's called the drying phase. So the drying phase is also not good. You will have a lot of wet packs in it. So the importance of drying phase is to avoid wet packs.